Envision this. You're laying on the ground playing with Legos with your kid. You go to reach for a block and your right arm isn't moving. You go to yell for help and nothing comes out. These are the beginnings of a stroke. What is a stroke? Stroke is the sudden death of brain cells caused by either a blockage or hemorrhage, which is bleeding in the brain. Blockage is also called a thrombose and causes ischemia further along the brain, which is brain death. According to the Mayo Clinic, approximately 795,000 people will have a stroke this year. Of that 795, 140,000 people will die. What we're going to talk about is how a stroke is treated depending on the time frame from which it is discovered. We go from 0 to 4.5 hours, 4.5 to 12 hours, and 12 to 24 hours. As soon as you arrive to the ER, a CT scan will be performed to discover what type of stroke you're having. While the scan is being performed, the nurse will grab a package like this that has all the protocols, policies and procedures, and medication list that will be used to treat your stroke. So, scan comes back, says there's a thrombus, which is the blockage in the brain, and we're under our 4.5 hour mark. We can treat it with a medication called TPA, Tissue Plasminogen Activator. TPA is a clot buster that will travel throughout the body and dissolve any clots in the body, including the brain, which will allow blood flow to return back to normal. For TPA to be given, there is a checklist that has the inclusion criteria, which is the patient's age, that they have stroke symptoms, that they're less than 4 hours onset of the stroke, and that it is confirmed ischemic, which the CT just proved. The exclusion criteria is quite extensive. There cannot be any head trauma in the past 3 months, no drops in sugar, no seizures, no pregnancy, any type of neuro deficits. Once these are all confirmed negative, the patient can be given the medication. The medication must be held very strictly to the 4.5 hour mark. A neurologist will not allow the medicine to be pushed after that point. We had once a patient that came in at hour 4. By the time the scan was done, the medication was drawn up, and everything, and the checklist was completed. The patient was receiving the medication at 4 hours and 28 minutes into their stroke. 2 more minutes, the patient would not have received the medication, and they would have had to learn to live with their new deficits. This one was lucky, the medication was in, and he ended up having a full recovery. After our 4.5 hour mark, we moved to our 4.5 to 12 hour strokes. This is where we treat our small vessel strokes. These are clots somewhere in the smaller vessels of the brain. They affect our finer details, such as speech, vision, sensory, and understanding, following commands, so on and so forth. This is performed by using the NIH scale, which is in our lucky packet, and has an extensive list of questions and checklists to verify where the stroke is located and what's being affected by it. Once the NIH is performed, where the stroke is verified or where the location is, the neurologist can do a thrombectomy, which is they'll run a catheter up the body with a claw on it. Depending where the stroke is at, it can grab the clot and pull it out and relieve the blood flow to that area of the brain. If the thrombus cannot be removed, the patient will have to go to rehab to learn to live with their new deficits. They will also be put on medications and surgeries such as opening the carotids to prevent any further strokes. In our 12 to 24 hour mark, this is where we'll treat our large vessel stroke. Large vessel strokes have to have a motor issue because where they're affecting in the brain, they affect the motor sensory of the body. So there will be a motor issue. Then there also has to be either a vision issue, so they can't see something right, they can't speak right, which I'm pretty sure I'm having aphasia at this point, and they're also having neglect, where they don't notice a sensation on the body, or they don't notice something around the room that they should see. These patients are treated with thrombectomies, same as for the small vessel. Neurologist will run up a stent, grab the clot, pull it out, and relieve the symptoms. This can be done up to 24 hours. In some cases, can be done past that mark, but it depends on the neurologist case by case. All these strokes can be treated in the different time frames. They do not have to be treated in their specific frame, depending on what the stroke is. Large vessel can be treated from 0 to 24. A small vessel can only be treated from 0 to 12. That's where our assessment skills come into place onto what the stroke is and how it's going to be treated. So we covered when our strokes are treated, where they're located, percentages of recovery. Thanks to our rehabstroke.com, stroke.org, their statistics show that 10% of stroke survivors will have no deficit, 25% will have minor impairments, 40% will have moderate to severe impairments. They'll be dragging a leg, dragging an arm. 10% will require complete nursing home care, those sadly becoming vegetables. And 15% will die shortly after the stroke. Those will be part of that 140 that die annually. Hope this was a learning experience. Thank you for your time.